So I will now introduce the next speaker for the last best practice on personalized medicine policy. And the speaker will be Walter Kolch. He's director of the Systems Biology Ireland and the Conway Institute at University College Dublin. And he works on oncology and how systems biology can help clinical advances in personalized medicine. Thank you so much.
Good morning. Great pleasure to be here. It's a really interesting and very inspiring conference. I'm going to be talking about a training program for postdoctoral fellows in precision medicine, which we are running. And the program is called TopMed 10. And this is what the program is all about. So what we are trying to accomplish is training the next generation of scientists and clinicians for doing precision and personalized medicine. And we all know there's a huge skill gap there. We all know that we somehow need to close this. And this is a baby step or a small step in that direction. The outcomes here on the right side, what we want to achieve is holistic personal profiles which are based on molecular data. And the way to produce them is actually integrating different data. We have become very good in producing various types of omics data, not only genomics, but also transcriptomics, metabolomics, proteomics. These are technologies which are on the verge to go into the clinic. However, we are not so good or lagging behind in actually interpreting this data. So what we try to do is integrate this data and interpret them through molecular modeling. And the idea, computational modeling, and the idea is to produce a digital twin. This is something what is very well known in the engineering world. When engineers design a car, they design it first on the computer and crash test it on the computer, drive it on the computer before it actually is being built. And the idea there is similar. Before we give new therapies to patients, we test drive those therapies on a digital twin of the patient. So this is the aspiration. And we are making the first steps towards that aspiration. And of course, if we achieve that, then the result will be better therapies, finer diagnostics, better prevention, better quality of life, and also, as been mentioned a few times now, saving costs for the healthcare system. So this is the TopMed 10 fellows. The middle two is myself and our VP for Research, Orla Feely. The other ones are the fellows. The program is run as a collaboration between 3 UCD institutes, the Charles Institute for Dermatology, Systems Biology Ireland, and the Conway Institute, and 2 university hospitals, the Mater and St. Vincent's. So it is a truly interdisciplinary and translational program. It's very much built on using omics technologies to achieve a better understanding of disease mechanisms, in particular looking at shared mechanisms, molecular mechanisms which are common to different disease entities and which are suitable for being targeted with therapeutics. And the application areas are mainly dermatology, inflammation, and cancer, and this is really based on the participating institutes because this is where the interests are. It's a co-fund program, so 42% of the funding comes from the European Union, and the rest comes from other funding sources. And it's actually fairly interesting to look at these funding sources. So there is national funding agencies, Science Foundation Ireland, the Health Research Board. There is also industry, government departments, an SFI research center, and a charity. And I think that actually demonstrates well how widespread the interest in personalized medicine has become now. It's not only like a particular source who are interested in co-funding such programs, and that's an educational program, so there is actually not a direct benefit there, but it's an indirect benefit because you train the next generation. But I think this is a really good sign, seeing that there's a really good interest there. So the TopMed 10 fellows, as you see, we were not so good in achieving gender balance because we have 8 females and 1 lonely male. But the fellows come all from different countries, 4 different continents represented. The reason why we haven't achieved gender balance is actually because we strictly did the selection process only and purely based on excellence. So we had applications. not making any implications what this means in light of the previous slide. But we had an electronic application system, and we actually had an external review board. So we had external reviewers. There was nobody involved from the potential supervisors or from UCD. And they ranked the fellows, and the top 30% were called for interviews. The interview panel was then a mixture between potential supervisors from UCD and external, two external reviewers, and then the top 30% of these people actually received the fellowship. And this is how it happened. We originally had fellowships at 2 levels, junior postdoc for 3 years and senior postdoc for 2 years. As it turned out, all the successful candidates were junior ones. Again, I don't know what this means, but it's a good sign that actually people who just have graduated are really keen and eager, to do something new. And this is also why TopMed 10 became actually TopMed 9, because in order to finance the 3rd year, we had to sacrifice 1 fellowship because we didn't have money for 10. The main emphasis is on training. Training is delivered on several levels, the local level, but also we leverage all the UCD resources which are offered for training. We also actually leverage external collaborators, both from academia and industry, and a main emphasis is on technical and transferable skills, because this is where we think the biggest gaps are. UCD runs actually a number of training programs with particular emphasis on professional development and employability. So these are courses about grant writing, but also tailored courses. So we're not only trying to be tailored and precise in medicine, but also tailored and precise in training, where individuals can close their competency gaps. We also have a big emphasis on development competencies, so where people actually promote their own personal development for their future career. And a particular emphasis, as I said, is technical and transferable skills. So one big thing is actually research and research management. And we all know the times where research meant you were sitting on the bench pipetting away or sitting in your room and having great thoughts. These times are over. We have to be managers, we have to be communicators, we have to do much more than just doing great science. We have to acquire the funds to do great science, and then we actually have to disseminate the science. So it's a much broader level of skills which is required nowadays, and this is what we try to communicate with courses, for instance, how to manage projects, how to write the grant, how to lead a group, how to build leadership in the lab. So it's very much about professional and personal excellence, so where people can develop their skills, but also these transferable skills which actually needed to succeed in science and produce good science and bring it to application. For people who want to stay in academia, we also offer courses in teaching and training. And we also offer courses in innovation and entrepreneurship. And again, this is actually reflecting how the world has changed, because industry and academia were 2 separate worlds, but now they're sort of converging. And it's not impossible anymore to work in academia and be an innovator, and the other way around. And I think this is, again, a good development. One thing which has been very successful was the fellows have a personal electronic diary, where they record not only their experiences, but also the training they have undertaken and their activities. And they actually, at the end of their time, get an official certificate from the university about the training they have done. Because we had often heard, well, I do all this training, but I have no proof that I actually have done it. So we actually provide that proof. And this is something that was very, very well received by the fellows. We also offer secondment, so we have academic partners, the University of Groningen, Cancer Research UK Institute, and the Max Planck Institute for Molecular Biomedicine, but also industry partner, a German biotech, Mosaics Diagnostics, an Irish biotech, Oncomark, both are focusing on diagnostics, and ICON, which is one of the world's biggest clinical trial organizations. And again, I think there is something to take home from this slide, because there's actually a lot of industry, in particular SME involvement in promoting precision medicine and personalized medicine and developing the diagnostic tools like these companies like Mosaics and Oncomark do. And I think this is also something what needs to be taken into account, that a lot of innovation comes from different fields now, academia, corporates, but also a lot is coming and driven by biotechs. Management is very simple, so we have a management committee headed by the Kolch dean, representation of the 3 institutes, also representation from some of the funders and from the HR department who is providing the training. And then we have a part-time coordinator and manager who do the daily running of the program. And I just want to sort of conclude to demonstrate, put a little bit flesh on what I'm saying, and introduce some of the fellows and the research projects to you. So this is Ariane Watson. She's co-supervised by myself and Callum Ryan, who's a bioinformatician. And she recently won the gold medal in the UCD Conway Festival for Research. And she's actually a former biochemist who now is on the way to become a bioinformatician. And again, this is something very instructive. We hope to see this more and more often, where people actually cross the boundaries between fields. And she's trying to find new targets for cancer treatment based on interaction between the epigenetic machinery and signaling genes. So a lot of the oncogenes actually function signaling pathways, and as you can see here, the green bars are the epigenetic mutations in epigenetic machinery genes, and the orange bars are mutations in signaling gene, and she's looking for which of these mutations co-occur or are mutually exclusive, and using a sort of synthetic lethality informatics approach to find potentially new targets, and it actually has provided really, really interesting results, and we are now going to the lab and will test them. This is another fellow, Kaylin Murphy, very different topic. She's working on nutrition, just recently won the Drummond Early Career Scientist Award from the British Nutrition Foundation. And she was actually coming into an ongoing trial called Nutrimal, which was comparing placebo versus a protein formulation and protein formulation plus unsaturated fatty acids for preventing sarcopenia, muscle wasting in elderly patients. And that study was existing, but what Kaylin brought into there was the molecular element, because now these patients are actually tested for metabolites in the blood. They receive muscle biopsies, and we're doing transcriptomics on them and test protein synthesis. So that is now underpinned by molecular mechanistic studies, and it is very successful. The participants are really interested. So Kaylin also has now her own blog site for not only study participants, but it's actually publicly accessible. Yet then, other topic is Huswini. She won the Best Poster Prize at the Irish Association for Pharmacologists meeting last year, and she is looking at inherited blindness, a condition where I think, well, it's inherited, there's no therapy. But actually there may be, and she uses a zebrafish model. So there is a zebrafish, and that you can see on the bottom left side, this deformed eye. That fish is blind because of a genetic mutation, which destroys the retinal layer, which is similar to the human disease. And actually, treating this fish with HDAC inhibitors, but only certain ones, can restore the layer in the, it's hard to see, but then on the bottom side, you actually can see that the retinal layer is restored. Sarinj Fatah, she's working on drug delivery in a disease called acromegaly. This is a disease hallmarked by overproduction of somatostatin, a hormone which makes things grow too much. And it's a chronic disease affecting about 60 million people worldwide. And there's a therapy available, but you have to inject yourself every day. And this is something that is not very, very difficult for many patients, and the compliance is not too great. So the idea is to make it more accessible to patients by developing drugs which can be delivered orally. And so the drug is being linked to a delivery vehicle, which enables protects it against degradation in the gastrointestinal tract, and makes it possible that the drug actually penetrates the barrier and arrives in the blood. And again, the results are very promising. And the last one I wanted to introduce is Suline Gateau. She is sort of truly translational. She's half in the clinic and half in our lab. And she's working on a clinical study which is co-sponsored by SFI and AbbVie. And that study is about identifying patients who respond to anti-TNF-alpha therapy in 3 different skin diseases, atopic dermatitis, psoriasis, and hidradenitis suppurativa, which is an especially nasty disease. And so we are using microdialysis from skin, which we analyze by proteomics and multiplex biochemical assays, and also skin biopsies where we do RNA-seq and immunostaining. And these data are being integrated, computationally analyzed, so that we make actually disease models for individual patients where we can predict who is going to respond and who isn't. And the study is co-supervised by a dermatologist, Professor Brian Kirby, and myself. So these were some of the people. As you've seen, they're actually quite successful. So we have really good outputs, both in terms of publications. Fellows have won several awards. They attended a lot of training sessions, and they actually found those training sessions very useful. And they also actually were very, very active in participating in public engagement events like Melanoma Week, Cancer Week, Science Week. So they were really very proactive in all of these things. And I just want to conclude with a few comments by fellows. So these were comments at the midterm review, which we recently had. And there's comments like, for instance, this program enables people to move beyond boundaries from one discipline to another, like Ariane becoming a wet lab scientist now into a hybrid informatics wet lab scientist. Most of the fellows find the environment very supportive. They find the training very supportive. And in particular, they see this really as a personal development opportunity, but also as an opportunity to do something new in science and for society. And I'd like to end with acknowledging the people who actually run the program. This is Aidan McKiernan, William Fitzmaurice, who has recently left, and Susan Yates. And I'd like to thank you for listening and ready to take questions if you have any.
Thank you so much. So there's a question over there, and we have time just for 1 or 2 questions.
Hello, thank you. My name is Fabien Astic. I'm a co-founder of a startup, and we are developing a digital twin. So my question to you is, well, it's very likely that our technologies are complementary. So I'd like to understand a bit more what you mean by digital twin here. What do you model that's related to the person in all your examples? And if your students want to work with the industry, as you mentioned, we need to do that now, they're welcome.
Yeah. So the digital twin is sort of the final goal. It is a bit too ambitious to really model a complete human with all the traits and diseases. But I think we can tackle this in modules. So what we are doing is we model, for instance, in the skin diseases, we model the healthy skin versus the affected skin, and we do this in longitudinally. So we take samples from the patients 3 times when they visit, and we try to see how this disease evolves. And in terms of methodology, what we have developed is approaches where we use statistical methods, artificial intelligence methods, machine learning types to deduce networks based on omics data. And then we use a statistical method which we have developed to extract dynamic models from these networks, which then can be converted in ordinary differential equation models where you actually can model dynamic processes or changes over time. So it's a statistical approach ending up in mechanistic models. And we take the data as we can get them, because the nice thing about this method is that it works with any data which you can convert into a network.
Maybe we can leave the questions for the next, because I see there's many questions, but I think Walter will be available to talk to you over coffee break maybe, and we have to progress.